Hello, our names are Maggie and Emma Delancey, and we're going to be talking about important muscles that are involved in synchronized swimming, specifically with holding your breath and stretching splits.
The first muscle I will be talking about involving holding breath is the diaphragm. The origin of this muscle is on the sternum and xiphoid process. The lumbar 1 through the lumbar 3 vertebrae, the arcuate ligaments, and the costal margin. Its insertion is at the central aponeurotic tendon. The action that this muscle does is inspiration. One type of injury that can occur to the diaphragm is a diaphragmatic hernia. A diaphragmatic hernia is when the organs in your abdomen move up into your chest through a hole in your diaphragm. People can be born with this, or it can develop later in life. The second muscle that I will be talking about is the scalene muscles. There are three types of scalene muscles: the anterior scalene, middle scalene, and posterior scalene. The anterior scalene muscles attach at the tubercles of the transverse processes of cervical vertebrae 3 to 6. The middle scalene muscles attach at the posterior tubercles of the transverse processes of cervical vertebrae 2 to 7. The posterior scalene muscles attach at tendons from the posterior tubercles of the transverse processes of cervical vertebrae 4 to 6. The anterior scalene muscles insert at the scalene tubercle and cranial crest of the first rib. The middle scalene insert at the cranial surface of the first rib, and the posterior scalene insert at the outer surface of the second rib. The anterior and middle scalene muscles flex the cervical spine laterally, while the posterior scalene muscle is involved with laterally flexing the neck. An injury that can occur with the scalene muscles is a strain. This may result in a lot of neck pain and difficulty moving your neck. Scalene strains can be caused by conditions such as asthma, bronchitis, COPD, and pneumonia. Scalene muscles can also be strained from actions such as whiplash, motor vehicle accidents, and poor sitting posture. The third muscles involved in holding your breath are the intercostal muscles. There are internal and external intercostal muscles. The origin of the muscles is on the 1st through 11th ribs on the inner surface and inferior border from the tubercles of the rib. They attach posteriorly to the costal cartilage anteriorly. The insertion is on the superior surface of the rib immediately below the level of proximal attachment. This muscle draws adjacent ribs together and elevates and depresses them during inspiration. An injury that can occur with the intercostal muscles is a strain. Symptoms include tenderness at the area, difficulty breathing, upper back and rib pain, inflammation, and muscle tension/stiffness. Scalene strains can be caused by many different activities, including car accidents and falling.
The first muscle I will be talking about involved in splits is the biceps femoris muscle, which is one of the 3 hamstring muscles located in the leg. The origin of this muscle is an attachment to the upper and inner proximal surface of the ischial tuberosity, more commonly known as the ischium or sit bone. On the short head of this muscle, it connects to the femur bone in the thigh. It is conjoined with the semitendinosus, one of the other 3 muscles in the hamstrings. As for insertion, the biceps femoris muscle attaches to the styloid process of the fibula, found in the lower leg. It then splits into 3 sections. The intermediate or middle section attaches to the fibula, while the 2 outer sections attach to the tibia. The biceps femoris muscle is responsible for flexing and rotating the knee joint and extending the hip joint, which is what helps stretch splits. Strained, torn, or pulled hamstrings are very common among athletes and can be caused by overstretching. They can be more mild, such as just a pulled muscle or a strained muscle, or they can be very serious and the muscle can be completely torn. For a mild injury, it may heal over a period of just a few days, while a more severe injury could take months. Warming up before you stretch can help prevent this type of injury. Another muscle involved in stretching splits is the iliopsoas muscle. Technically, this muscle is made up of 2 different muscles, called the iliacus muscle and the psoas muscle, that are so similar in structure and function that they are sometimes considered to be one muscle. They combine to be one of the strongest hip flexors in the body. Each muscle has their own origin, but joined together with the same insertion. The origin of the iliacus muscle is a broad area inside of the pelvic bowl, while the origin of the psoas muscle is in the vertebrae. The psoas muscle is the only muscle that connects the spine to the legs by connections to the lumbar vertebrae. The 2 separate muscles then merge into a common insertion at the femur bone. This muscle acts as a hip flexor. which flexes the hip joint and also rotates the legs, which is important in stretching splits. They are also vital in walking or running and holding your legs steady. This muscle can be injured by overuse, which can cause a pinching feeling or pain. This injury can occur if the iliacus muscle is contracted for extended periods of time and can actually be prevented or helped through stretching out the muscle. A third muscle involved in stretching splits is the quadriceps femoris. Similarly to the last muscle, this is actually a group of muscles coming together for one function. The vastus lateralis, vastus medialis, vastus intermedius, and the rectus femoris. The origin of the rectus femoris is the patella or kneecap, while the insertion is onto the hip bone. The other three muscles involved in the quadriceps femoris all have an origin of the femur bone and an insertion on the patella. The quadriceps help extend the knees, which is an important part of stretching splits. They are also involved in walking, running, and other physical activities, making them prone to injuries such as strains and tears. Just like the strains and tears of the biceps femoris muscle, they can be mild or severe, and depending on that, will have mild or severe pain and different recovery times. So this is our works cited from the project, and these are the links to all the pictures that we used. Thank you for listening.